Welcome to Healthline. Our guest today is Dr. Kristy Mascararenhas. She's been with us before, and she's an ophthalmologist with Middlesex Eye Physicians, and we're happy to have you back.
Thank you for having me back again.
Let's talk about glaucoma. Explain what glaucoma is.
So glaucoma is a certain type of change that happens to the optic nerve in the back of your eye, and your optic nerve is what carries the information about what you see to your brain, so your brain knows what you're seeing. So when a person's eye pressure gets too high for their particular eye to handle, the optic nerve hollows out gradually. And what that does is it changes your peripheral vision from the outside in. That means that sometimes people aren't aware that their peripheral vision is changing until years or decades into the time that they have glaucoma. So it's very hard to know about it without regular eye exams when it's at the beginning of the disease.
And what causes this to happen? Is it just aging, or is there something else in the body that causes the problem to begin with in the first place?
So sometimes we know and sometimes we don't know. There's about a dozen plus different types of glaucoma. Some of them actually have a cause like another disease inside the eye or crowding inside the eye. And other times the most common type of glaucoma is called primary open-angle glaucoma. And what that means is that we don't know where it came from. It does seem to be related to aging. That's one risk factor. Open-angle glaucoma is much more common if you're of African descent, and other types of glaucoma, like angle closure glaucoma, are much more common if you're of Asian descent. And then there are several other risk factors as well that we can tell when we examine people's eyes.
And what do you look for when you do that examination?
So we check a lot of different things when we suspect that somebody has glaucoma. The very first thing we check is the pressure inside somebody's eye, and if the pressure is above average, that's a clue that somebody has glaucoma. There are types of glaucoma that you can get where the pressure is average, and that can be confusing sometimes.
And when you talk about pressure, nobody can really feel this pressure, right? Or is it something that somebody might be attuned to?
It's rare for people to be able to feel their pressure going up. That's a particular type of glaucoma. It's called acute angle closure glaucoma. It means it happens very suddenly and to a great degree. So if the drains in somebody's eyes close suddenly, then the pressure will go up so quickly that will actually cause them a lot of pain. For the most part, when the drains in somebody's eyes don't work as well as they should, which is the basic problem in glaucoma most of the time, it happens so gradually that you can't feel it.
And at what point do you know it without regular exams? You said you probably wouldn't know until something would occur. You'd kind of lose your vision. Mm-hmm. Is that, and how does that happen? It doesn't happen all at once. It's a gradual loss of vision.
Right. That does happen very gradually, and it happens from the outside in when it comes to your peripheral vision. Since most of us don't use those parts of our vision knowingly every day, it's hard to see that happen. The good part, if there can be said to be a good part, is that this process takes years and sometimes decades to happen, so we have plenty of time to catch it as it goes. But what happens is your peripheral vision gets gradually more narrow until you end up with basically tunnel vision. When that happens, some people are aware of it. They find that they're not seeing things on their sides when they're driving, or that people startle them when they come up from the sides. But that's the point when people would really start to recognize that something is happening.
And once this occurs, is there any way to reverse the loss of vision that's already occurred?
Unfortunately, at this point, there isn't. We don't know how to reverse the damage that's already happened, but we do know how to stop it in its tracks. And the way that we do that is by lowering the pressure in people's eyes. That's actually one of the reasons why we always tell people to get regular eye exams. The earlier in the process that glaucoma is found, the better that person is going to see for the rest of their life.
And when you say regular exams, is it yearly, every other year? What would you recommend to a person, even a young person, let's say a teenager? How often should somebody have their eyes checked?
So past 50 or so, yearly eye exams, I think, are very important for a variety of reasons, and glaucoma is one of them. That said, if you know that glaucoma runs in your family, it's very important to have eye exams yearly, even younger than that. So if you know what age your parent was diagnosed, it's good to start about 10 years before that. Also, just to get a baseline eye exam when you're young, it helps to know whether your eyes have changed from the way they looked when you were young.
So that's interesting that this is something that can be passed down. You said that if a parent has it, a child could have it as well.
Glaucoma does run in families, although it doesn't have to. So if we know that somebody has a family history of glaucoma or a family history of blindness, we watch that person a lot more carefully than the average person.
You mentioned that nationality may play a role, or gender. Does gender play a role? Do more men or women tend to have glaucoma?
For the more common type of glaucoma, the open-angle type of glaucoma, it's pretty much equal between men and women. For the other type of glaucoma, angle closure glaucoma, where the drains in your eyes get crowded because there isn't enough space inside your eye, that seems to be more common in women. It also seems to be more common the older you get. That's the one that's more common if you're of Asian descent.
How about things like conditions? I've heard things like sleep apnea may play a role, and is that true?
They seem to, yeah. There's been some interesting research going on about sleep apnea, that when people have sleep apnea, it is more common that they'll have glaucoma as well. The interesting thing is that there have also been studies done about people who have well-treated sleep apnea. They haven't been able to show that treating sleep apnea actually helps glaucoma yet, but it would seem to make sense that it does.
How about things like obesity? Would you think that would play a role as well?
That doesn't seem to right now. It's interesting because there are certain types of diseases that kind of go along with glaucoma. Diabetes is another hot topic. We're not sure whether it's just because diabetes and glaucoma seem to occur in the same age groups or demographic groups. And we're not sure whether that's a risk factor for worse glaucoma or not. The results are a little mixed on the studies we've been looking at there.
You're listening to Healthline. Our guest today is Dr. Kristy Mascararenhas. She is an ophthalmologist with Middlesex Eye Physicians. As I said, she's been with us before on an interesting topic. Today is glaucoma. And what other risk factors do you think, besides sleep apnea and, well, the possibility of sleep apnea, how about eye drops, things like that people use for other conditions like dry eyes? Do any of these meds or any other types of meds contribute or could contribute, you think, to getting glaucoma?
Yeah, so this is actually where it's good to know what type of glaucoma you may have. When you have angle closure glaucoma, there are certain medications that can put you more at risk for an attack of acute angle closure, like we were talking about before. And that's the important thing to know when you have glaucoma. Ask your doctor to name what type it is. Antihistamines over the counter for allergies, decongestants for colds, some antidepressants, and some eye drops can actually cause an attack of acute angle closure to happen. And there are things we can do to make it safer so that people can take those medications and not have to worry about that risk. So that's very important to talk to your eye doctor about.
How about an acute eye injury? Would something like that possibly cause glaucoma?
So there is a type of glaucoma called traumatic glaucoma. And there are certain types of eye injuries that actually damage the drains inside your eyes. And sometimes that doesn't pop up until decades after the eye injury. So another reason to keep on getting those regular eye exams if you have an eye history.
Let's talk about those exams. What do they consist of? What types of exams and treatment happens once a person is suspected of having glaucoma?
Right. So in the exam, we check somebody's vision, we check somebody's eye pressure, we'll dilate their eyes and look at the optic nerve in the back of the eye. And there are other tests that don't have to do with us looking directly at the eye that can also tell us whether somebody has glaucoma. We can actually take a scan of the optic nerve to see if it's thin in areas that it shouldn't be. And we can also measure people's visual fields by doing a test called a visual field test. And that actually shows us whether you have problems with your peripheral vision.
And these are non-invasive?
They're non-invasive and they're completely painless.
That was going to be my next question, because I think probably some people might have concern. Is it painful? Am I awake? What exactly happens?
So you're awake, you're aware of everything that's going on, and you're comfortable while all this is going on. And one thing I should probably say in these COVID times as well is that we've changed the way we give eye exams, and we've changed the way that we do this testing so that it's as safe and disinfected as it can possibly be, so that you are not going to catch COVID from our machines.
And once these tests are done, somebody is said to have glaucoma, what are the next steps? Is it just surveillance or a repeated test? typically would happen to a person?
So there's a variety of things that can go on. Sometimes we can't really make up our minds whether somebody has glaucoma right at this moment, and we call them a glaucoma suspect. And there we would watch them a little bit more closely and a little bit more often and keep on doing these tests maybe twice a year to see if there are changes. If we do decide that somebody has glaucoma, then we go ahead and we treat them and we lower their eye pressure to help take the strain off the optic nerve and to stop it from changing. There are several things that we can do to make that happen. The most common is probably eye drops that people would take once or twice a day, just like a regular medication that you would take, say, to keep your blood pressure down. If people can't or don't want to take eye drops, there are lasers that we can do to help keep the pressure down. The lasers are done in the office and they're also non-invasive, and that can help lower people's pressure anywhere between 1 and 5 years before we have to do the laser again. If people have gone through their drops and gone through the laser procedures and they still don't have the pressure that we want them to have, there are also various types of glaucoma surgeries that we can do, where either we make the drains inside somebody's eye more efficient at doing what they're supposed to do, or we make the eye make less fluid so the drains don't have to work that hard. Or in a more invasive surgery, we can actually bypass the drains that aren't working and build somebody a new drain so that their pressure goes down.
Are there typically any type of drawbacks to these type of procedures or surgeries? Something, maybe side effects that you wouldn't want, obviously?
So just about everything has side effects to it, and that's actually one of the reasons why we talk so much with people who have glaucoma to figure out what their lifestyle is and what would be easiest for them to be able to do to help control their pressure. Some people, if they travel a lot, they don't want to worry about having a bottle of drops with them all the time. Some people, if they have dry eyes, the drops don't interact all that well with their dry eyes, so we pick something else to make them more comfortable. Other people don't want to try procedures if there's anything else available to them, and those are the people that drops function well for. When we do a more invasive glaucoma surgery, actually going inside the eye to change somebody's pressure, whenever we do that, there's always a risk that something might happen that we don't like. So when we do a procedure like that, we want to make sure that we're doing it for the right reasons, that we think that it's going to help somebody more than the risk that it might hurt.
What is the success rate for treatment? It is probably not 100%, but it's got to be up there.
It's not 100%, but it's very good. For the most part, if we can get somebody's pressure down and we can keep in good contact with them so that we know that things aren't changing, we can stop glaucoma from progressing and causing problems with somebody's life the vast majority of the time.
What happens when all the treatments have been exhausted? Is there something that normally is not done? Is there another level, let's say? Is there a referral to another agency or organization? What happens?
So the good part is we almost never get to that point where we've run out of things to do. That said, if somebody has been losing vision because of glaucoma and they get to the point where their vision makes it hard for them to function in everyday life, there are lots of organizations in this state and around the country that help people live their best life with the vision that they have. One is the Lions, and the Lions run low vision clinics all over the country, and they have several in Connecticut, and just about everything they do is free. And that can actually help people with different devices to maximize their vision, tricks to help them navigate around their house and around the neighborhood. And there's also a state organization that helps people who are legally blind.
Is glaucoma the leading cause of blindness in this country?
It's one of them. Yep, it's very close.
Does it ever get confused or misdiagnosed with other eye conditions, or is it pretty much that it's glaucoma?
It can, especially the low-pressure type of glaucoma, and it can also coexist with a bunch of other conditions where maybe we treat the other conditions, but the glaucoma gets kind of missed or put by the wayside for the moment.
And if people want more information about glaucoma, how could they get a hold of you?
So they can go to our website at middlesexeye.com. If they want more information about glaucoma, the American Academy of Ophthalmology, AAO.org, or the American Glaucoma Society, AmericanGlaucomaSociety.net, all have information for patients on their websites.
Dr. Kristy Mascararenhas, thank you for being our guest today on Healthline. Healthline is produced by the Community Health Education section of the Middletown Health Department, which is solely responsible for its content. Please join us again next month at this time for another edition of Healthline.